Hello and welcome to our COVID chat. We're going to be talking about COVID vaccine and the latest on numbers and so forth. And with us is NorthBay Healthcare's Chief Medical Officer, Seth Kaufman. Take it away, Dr. Kaufman.
Hey, good morning, everybody. Dr. Seth Kaufman here. I'm your Chief Medical Officer and an emergency medicine physician here at NorthBay. Thanks for joining us. We have been doing these sessions pretty much every 2 weeks since, early in the pandemic. Well, welcome. As usual, I'm going to start with a few hot topics. You could probably guess what they're going to be today, but we're going to talk about a few hot topics. I'm going to include some of our county numbers, some NorthBay numbers, and then we'll go right into your questions. So let's start. I'm not going to start with Johnson & Johnson. That's the second topic. I just want to start with our numbers, and the hot topic really is that things are looking pretty good right now. And I want to comment on that, and then we'll go into Johnson & Johnson vaccine, and then we'll go into your questions. So we are seeing very low hospitalization rates right now. Here at NorthBay, when we are essentially seeing just a fraction of what we had, in the winter months. We know that's across the state. That's what we're seeing. I'm part of many different groups of hospital systems talking about what their COVID numbers look like, and overall, we just have not seen so far a significant increase in our hospitalization rates. Solano County right now, if you go to solanocounty.com, you can click on, just get the COVID dashboard. You'll see that in the county, they're reporting 24 hospitalized patients over the 3 health systems that are in our county, right? Sutter, Kaiser, and NorthBay. And so that's amazing. I mean, that is really, we're looking at, an eighth, maybe a sixth of what we had during some of the previous spikes. So what does that mean? Does that mean the vaccine's effective? We know the vaccine's effective. We've been very good at vaccinating those at high risk. So even if we start seeing an increase in our case rates, like more and more positive cases, the question is, will the hospitalizations follow, or will there just be a little bump? And that's what's most important. I don't want anyone to get COVID. COVID stinks, right? But the most important metrics are people getting hospitalized for COVID, and are they dying of COVID? If we can prevent those, then that really changes things. And when the Governor Newsom announced that June 15th is the goal for completely reopening, kind of getting beyond the blueprint. So ending the tiers, everything's open at some new capacity, maybe normal capacity, I don't know. The goals, the metrics being followed to reopen on June 15th talks a lot about hospitalizations, right? Because if you don't have any ICU beds, you're in real trouble, right? If our entire hospital's full of COVID patients and some are dying, that's where things are really bad. And a little less so much about whether people get mild symptoms, mild illness. We don't want anyone to get COVID, but the metric to follow really is who's dying and the hospitalizations. And right now they're low. They bump up a little bit, they go down, they go back and forth. It's very manageable right now. We are protecting our community with the vaccine and some of our other measures, mask wearing, distancing, hand hygiene. I would anticipate that if and when we can open safely, completely reopen, whether that's June 15th, after that, before that there's going to be it's going to be a new normal. It's not going to be exactly the way things used to be. There's still going to be mask wearing in certain environments, whether it's big public gatherings indoors or other things. I'm sure over time there'll be new rules and regulations around tables and restaurants and things like that. I don't have any real stuff on that right today, but I know that's going to happen. And I also anticipate that, and we're already starting to see that, there'll be some rules around vaccine status. So there'll be kind of a vaccine passport system of some kind. That's not fair to do those kind of rules, regulations, when vaccine access is not open to everybody, right? You can't say, hey, if you've been vaccinated, you can travel the world, but if you're not, you can't. What if you haven't made available the vaccine to all your citizens, everybody, right? But we're getting there. So I think that will happen. I think if you look at other states and what they're doing, they're starting to develop the idea of maybe using the vaccine status as criteria, maybe to avoid having to get tested, like they're discussing in Hawaii. And we already know there are some relaxation of the rules, with quarantining if you're vaccinated. So I think that's coming down the line. On that note, one other important metric is the county reported this week that a little less than half, they're estimating that a little less than half of the of Solano County individuals, adults, have received at least one shot of vaccine. A little less than half. So that's really good. That's really good. That's not herd immunity though. We got to keep going. We got to keep vaccinating as many as we can. The Solano County announced yesterday, and today the rest of the state goes live with vaccine eligibility for anyone 16 and older. So that's great. Of course, the problem is that the bottleneck, the rate limiting step right now is vaccine supply. But everybody who's listening, if you're not vaccinated and you're 16 or older, go get vaccinated. Try to get vaccinated. Remember, there's two things you should be doing right now. If you're out there and you're not vaccinated and you are 16 or older, there's two things I want you to do. You go to myturn.ca.gov and you register. And it'll show that you're eligible because you're 16 or older. You might see appointments on there opening up. I think it's hard to get an appointment right now this week. It changes every week. Next week there could be a flood of appointments, so you just have to keep checking back. The other thing I would do is go to solanocounty.com, click on vaccine information. There's maybe a few different clicks you have to go. Just keep hitting the vaccine button. You'll get to the vaccine information form. Fill out one of those. That Solano County will be transitioning to MyTurn, but right now you want to have both filled out. It all takes 2 minutes. It really takes 2 minutes. So do that. Let's talk about Johnson & Johnson. 6 women, or all women, developed a cerebral venous sinus thrombosis. So it's a clot in the brain. You have little sinuses in the brain. They're little pockets where we have blood, and it clotted. And actually had low platelets. And if you're in healthcare, you might be confused by those two things. Doesn't low platelets mean you bleed? And actually, you can bleed in those conditions. And we have one is in critical condition, and one passed away, one died, and from bleeding. So you can both bleed and clot from that condition. The CDC's ACIP did the right thing. They recommended pausing, and they're investigating these cases. That's for the millions and millions. It's really 1 in a million. I think at the time there was 6 or 7 million Johnson & Johnson vaccines administered in the United States. That's a very low number. Are there more cases out there that have been not diagnosed? Maybe, probably, maybe. Are there other clotting disorders that could be connected to the vaccine? Really hard to know. When you connect that with the AstraZeneca vaccine, which has a similar mechanism of action, it starts being concerning that there's a causation and not just correlation. In other words, did the vaccine cause this, or are they just correlated with each other? But also know that sometimes it looks that way all the time for certain things, but when you really do a careful objective study, it turns out just to be correlation and not causation, but we will see. The other thing to consider, to be mindful of, is that these are really rare conditions, and getting COVID and dying from COVID is more common. So in medicine, we constantly, and I've said this before on these talks, we have to constantly weigh out the risk and the benefit of everything we do. The radiation exposure from CAT scans, the side effects from medications we prescribe every day, that's constantly, we discuss it with our patients. We are, doctors and others, and pharmacists and nurses and everybody are constantly reviewing the literature to say, are there new side effects and what does this mean? Cancer doctors all the time looking at chemotherapy, the treatments, because there's harmful effects for a lot of those treatments, but is it beneficial to the cancer enough that the benefit outweighs the risk? That's the so the first thing with the Johnson & Johnson is this correlation or causation? Are we seeing more than we should be for that size population? Because remember, for millions of people, some people are just going to die. That's how the world works. Out of millions of people just die. Some people can get these very rare conditions, but that's that they have to figure that out. And then the next question is does the benefit outweigh the risk? And I'm thinking if they do decide that there is a causation there, this is such a rare condition that I don't think that means Johnson & Johnson is not going to continue to be a very good, viable option as a vaccine. Don't quote me on that yet. I want to see what the investigation looks like, but that's where I think it's going to go. And then the question is, do we create some, just like we did for anaphylaxis for the Moderna and Pfizer vaccines, do we create some warnings or exclusion criteria? These were generally in younger women. We have not seen any of this in older individuals. Some European countries are continuing to use the AstraZeneca vaccine, but have restricted it to older individuals, as an example. So there's ways also to try to mitigate having more of those cases. So more to come. We'll see where this goes. This is the right thing to do to pause it right now. It's disappointing because we don't have a lot of vaccine right now. And so to suddenly now lose our Johnson & Johnson, whether it's going to be for a few weeks, which it will be at least a few weeks at this stage, or longer, is disappointing. But you should feel confident that, like, hey, the CDC and the organizations, the advisory organizations that feed the CDC and advise the CDC and the FDA and our government are doing the right thing. They're being extra cautious. They're stopping. They're investigating, and we'll go from there. On that note, by the way, the reason why things are going so well right now is the vaccine. The vaccines have been amazing. It's the amount of side effects and let's say harmful effects we've seen from it has been unbelievably low. The efficacy, the impact, the positive impact of the vaccine is way above what anyone would have imagined, and it's gonna hopefully get us out of this pandemic. So a reminder that these vaccines are amazing. If you have an opportunity to vaccinate, and you have not been vaccinated, obviously, and you have an opportunity, whatever vaccine is permitted, and you get invited whatever vaccine you have available to you, you should get vaccinated. You should get vaccinated. Okay. On that note, I think we're going to go into questions. Those are my hot topics. What do we have, Robin?
Well, first, a quick question from Concepcion.
Yeah.
Her husband lost his copy of his vaccination card. He got vaccinated at NorthBay. Can he get a replacement card?
Yeah, there's ways to do it. I don't know the process that well for that. I would just start by reaching out to your primary care doctor, and he or she's staff can help you get a replacement card, but there are absolutely ways to get a replacement card.
This should be in your medical record, shouldn't it?
Yes, that's a good point too. It'll be in your medical record. But I would just start with your primary care doctor, and they'll get you another copy.
Okay. Raja, I'm not sure if I'm saying the name right, is
asking, your name, sorry. Yeah.
How does the vaccine prevent a person from being COVID positive, or does the vaccine just lessen the severity and symptoms?
How do the vaccines keep you from being COVID positive, or does it lessen the severity and symptoms? Okay, so we know that for Moderna and Pfizer, both the studies from the trials and the studies in the natural environments, not an actual study, but what we see over and over again is that they're 90% effective or higher from actually getting COVID, and they're 100% or super close to 100% from getting severe disease. So that means there's still some people who get COVID, they just don't get hospitalized and really sick and die from it. And that's the most important thing. How does it work? It essentially, the two mRNA vaccines that we are using right now, and because Johnson & Johnson is a different kind of vaccine, but it's on hold, it triggers your body to create antibodies to the virus. And so when you're exposed to the virus, you essentially have antibodies already developed, and you don't get the illness that way. You still can have a chance of turning positive, right? Because you get COVID. The vaccine does not create positive COVID tests. Swabs does not. It will create positive antibody tests, which is a blood test, and we don't really use to diagnose COVID. But if you're getting swabbed and you turn positive, it's because you have COVID if the test is accurate. But so you could still get it. It's essentially the virus could break through your antibodies. We call it a breakthrough infection, and you can get sick from it. But we know also that in all those situations, people don't get severely ill. So you create antibodies just like you do, for all the vaccines you've had in your life. Generally, the final and common pathway is either antibodies and cell-mediated immunity. Essentially, you have cells and antibodies against that virus, and it keeps it from when it gets to your mucous membranes, it essentially creates a barrier from you getting sick. So I hope I answered your question.
Yep. Kathy is asking, are there new or different treatments for COVID patients now?
Kathy's asking, is there new or different treatments for COVID patients? Yes and no. There's a lot being studied right now with a lot of focus on orals. Like, is there just something we could take, a pill we could take to keep us out of the hospital? But nothing's been approved yet for that. But what's changed is that with the variants that are so common now across the world, that the monoclonal antibody treatments have changed to make sure that they work against the variants. So we used to only use one treatment for monoclonal antibodies. Now we are no longer doing that. We're using combinations of two different monoclonal antibody treatments for people who qualify for that, and we could talk about that if people want. To make sure that we're covering the variants and the wild type, the original COVID vaccine. So the only real change right now, but there's a lot coming down the line, is that we do a combination treatment for monoclonal antibodies and not just a single treatment for monoclonal antibodies. By the way, you cannot get within 90 days of each other, you can't get vaccinated and the monoclonal antibodies, so we're using it less and less. And that's the one treatment for people with mild symptoms who don't require hospitalization, and generally it's restricted for those at high risk, older, and or have comorbidities, diabetes, are immunocompromised, and other criteria, have lung disease, things like that. So, and that's the only real effective treatment that we're seeing right now, and it's an injection. It's not an oral for those with mild symptoms to keep them out of the hospital. Otherwise, steroids and other things are what we use for hospitalized patients.
Okay, Erica is asking, I'm fully vaccinated.
Great, Erica.
Can I visit my grandparent who is also fully vaccinated without masks?
The question is, the scenario is, there's a high risk family member, so older person, grandmother. We're both vaccinated. Can we be without masks? No, at this stage right now, the CDC is not recommending that. You might be asking, no, I don't want to know what the CDC, I want to know what you think, Dr. Kaufman. I agree with the CDC right now, and just for now, I think a little more time. We just need a little more time to see that we continue to not have a spike of cases. Mask wearing is so effective. We don't want to see illness in our high-risk patients. The CDC, they said a lot of mixed messages in the last month, but I think you're much more better off. I think you should wear a mask, period. I'm very conservative with this, though, so please, keep that in mind. Safety conscious around this. I think I have zero tolerance for seeing transmission if we can avoid it. But in general, the idea is that there's two vaccinated individuals and they're not at high risk. The CDC is saying, hey, you could have an interaction. I would still be careful right now. I'm still watching the variants and just seeing what they're doing. I think we just need to continue to watch that, especially some of these variants of concern that are not spreading very quickly. They're not spreading at all right now in California, South Africa, Brazil, new one from India. Those we still don't know really completely how they're going to impact our case rates. What we see in Michigan and the upper kind of Midwest is very concerning. So at this stage, I would say no right now, but we're getting close. So maybe next time we're talking, I'll tell you, go have that interaction. It's so nice and warm outside. Can you guys do something outside in the backyard, for instance?
Okay. Rosemary asks, my friend developed inflammation on her armpit of the arm where her Pfizer shot was given. Is this a common side effect of the vaccine?
People have sore... Can you read the question again? Sorry, where's the...
In her armpit.
In her armpit.
Of the arm where she got the shot.
And it's red and swollen?
She just said inflammation.
Inflammation, okay. I would need more information. People do have some redness and soreness at the site of the vaccine. The inner armpit area is not where the vaccine is located at all, so I would say that is not common at all. and could just be coincidence. Again, correlation or causation.
Yeah.
So just get it checked out. If it doesn't go away or you have a concern, I would just send a photo to your primary care doctor, let them weigh in. Maybe you're getting a little infection there. But not on the inside armpit. We have not seen that.
Okay. Lorena asks, how long after having been ill should you wait to get vaccinated? Does that matter if you were on antibiotics, for example?
Ill, not ill with COVID, just ill, period. Yeah, it's the same rules as what we recommend with all vaccines. We want your body to fight one thing at a time. So the question, by the way, is I have an illness, maybe a cold or not a non-COVID thing. I'm on antibiotics, which you don't need antibiotics for a cold, but it must be something else. When can I get the vaccine? When you're well. And I know that seems like duh, but not duh, but like that's going to be the obvious answer. But it is. That's all it is. We just want you to be really well. So give it some time. We don't want you spreading stuff in vaccine clinics, anyways. Let your body really heal, and then go in for the vaccine.
Okay. Kathy asks, what is the time frame after your second vaccine that you should wait for a cortisone shot and a mammogram?
Okay, so the question is after your second vaccine shot, how long do you wait for a cortisone shot and then a mammogram? A mammogram, I see. I don't know that answer completely. Hydrocortisone can be an immunocompromising injection, so it definitely is important not to get it right away. The reason why I don't know that answer, it's probably a little dependent on what you need it for, right? So again, we're always weighing out risk and benefit. I don't know that answer. On the first one, you got to talk to your primary care doctor. If on the mammogram, it's a diagnostic test, so if those are separate, you don't need one for the other. I don't think there's any reason why you can't get a mammogram right away. But the hydrocortisone shot is a different story. Ask your primary care doctor. Sorry, I don't know that answer.
That's all right. Susan's asking, if someone has factor V Leiden.
Yep, factor 5 Leiden, yeah.
And they received the J&J vaccine.
Yeah.
Does that put them at higher risk for getting blood clots?
Yeah, I don't. The factor 5 Leiden, which is for those who don't know, is a condition where you can clot. And the question is, well, now I have Johnson & Johnson, which may be shown to also clot. Does that place me at higher risk? No one, to my knowledge, knows that yet. And it wouldn't change you just kind of being aware and being in touch with your symptoms and reaching out if you have severe abdominal pain, shortness of breath, leg swelling, a severe headache, some of the stuff that is all over the news wires and CDC recommendations. At this stage, it wouldn't change. It wouldn't change the recommendations of really being in touch with it, whether you have symptoms. Talk to your primary care doctor. See if. But I'm not aware of any studies or stuff putting out that those who are already at risk for clots now are at higher risk. It might be true, it may not be true. So talk to your primary care doctor. I think it's too early to know. Remember, though, that at this stage, so what we have right now is 7 total cases. There's the 6 women, and there's a patient. It was a male from the actual phase 3 trials that also had this condition, the brain clot. So very rare right now. So remember that it's very rare. Any way you dice it, whether it's you're a little higher risk, it's still rare at this stage. But beyond that, it's too early to really know.
Okay. Are there other blood clotting disorders that you should be concerned about it if you had the Johnson & Johnson?
The only one that I'm aware of, the other blood clotting disorders to be aware of if you also had Johnson & Johnson, is right now my understanding is that those who've had the heparin, if you've ever received heparin medication in your life and you had this the low platelet disorder from that, you know if you've had that, you know about it. That I know is if there's a causation, it may be linked. That's something absolutely to tell your doctor to talk to them about before you would get the Johnson & Johnson vaccine.
Okay.
Besides that, I think if you have a clotting disorder, it's on hold right now. So you've either received Johnson & Johnson or you don't have an option for it right now. But if you have a clotting disorder and you are concerned, I would reach out to your primary doctor. Just talk to them about it. I know they're They know, we probably know the same information. It's too early to completely know, but it's not bad to have it on the radar thinking about it right now. But you don't have an option for Johnson & Johnson right now anyways.
Okay, the recommendation to get the second shot is at a month apart.
For Moderna, it's 3 weeks for Pfizer.
With the vaccine shortages and not able to get a shot by the suggested date, how far out can you wait for the second shot?
Yeah, it can be farther out. We're really trying. The question is, if with the vaccine shortage, how far out can you get the vaccine, and you don't have to start over with the series. Other countries who had this issue allowed 6 weeks, to go out 6 weeks, to go out farther. I don't. In the U.S., we don't have a finite time that I'm aware of. We really try for the 3 weeks for Pfizer and the 4 weeks for Moderna, and many, I hope you'll have I know for our system, we are scheduling that second appointment, and we are keeping a dose for you. So I guess what I'm asking is, I hope that's not an option. I'm hoping that's not a choice you've had to make. But honestly, if it is, going out a few weeks after is probably going to be just fine. So I guess it's kind of a round thing. Like we're not, I've been told I can't show up for at the 4 week mark for Moderna because we don't have enough vaccine. When are they going to tell me, sorry, you have to start over? I think it's going to be, you're still going to be able to get a second shot, let's say 6 weeks, even a little far longer after that. So just hold tight. Don't be concerned that you have to start over yet. Keep trying to get that second appointment in. If you were vaccinated at NorthBay, which is not Moderna, it's Pfizer, you got a second shot. You got a second shot appointment right at that time, and many of their systems are doing that too. And we're trying to do our best to make sure there's always a second shot for you. Okay.
Is it still recommended to avoid ibuprofen for muscle soreness?
You are asking very good questions today that we haven't talked about in so long. I just keep reading the data. Is there still rules around using ibuprofen for muscle soreness? So here's the general rule, is that we don't want anything here's what CDC is saying, and I agree with CDC. There are studies showing that if you take antipyretics, we're out of time, aren't we?
No, we got 3 minutes.
My staff here is looking at the clock. So I see. We have 3 minutes. There's that you don't want to take any antipyretics preventatively before the vaccine. So please don't pop some Tylenol or ibuprofen or naproxen or any of the any of the anti-fever medications, pain medications prior to getting your vaccine. That's probably going to will decrease your response. And then after that, it's really it's the way the wording is like try not to a little bit. So if you for the first 24 hours. So if the way I did it is unless I have really severe symptoms and it's really intolerable, I'm going to try to avoid taking Tylenol, ibuprofen. Ibuprofen early on, there's a thought of a concern not to take it. There's nothing that you don't need to avoid ibuprofen. It's okay to take a Tylenol or ibuprofen after you take it, but the farther out the better, and only if you have severe symptoms would be my recommendation.
Okay. Do we have any more information on how long the immunity will last with these?
The question is, do we have more information on how long the immunity will last with these? And the answer is yes. What Pfizer and Moderna are doing, they continue to follow their phase 3 trial participants. So, at the 3-month mark, they measured all their antibody levels, immunity levels, and they said, hey, it's still pretty strong. And then just recently, we are at the 6-month mark, and they said, hey, it's still really strong at 6 months. So the reason why you don't hear it farther out is because we haven't been using the vaccine that long. So the answer is yes, right now we know there's strong immunity at 6 months, and I think every 3 months we're going to hear more about it. What we don't know really is how long immunity lasts, or for the natural infection. I know there are some out there saying, well, I had COVID, I'm not going to get vaccinated, and I would recommend you get vaccinated. We don't know how long the natural immunity lasts. CDC has said you could wait 90 days from COVID to vaccine, from having COVID to getting the vaccine, because we think you're pretty protected for those first 90 days. I'm not sure we completely know that. We don't know completely what the factors are with the variants in that. People mount very different responses to COVID. Some may have very few antibodies, kind of cell-mediated immunity. Some may have had a really robust response. So my recommendation is if you had COVID, still get vaccinated. If you've been vaccinated, it looks like up to now, we know we don't need a booster shot at 6 months. Probably in our lives we'll need a booster shot. It's hard to know. That's what I got for you today. Okay, so a few things, logistics. We are going to go to once a month right now, as there's not a lot of new updates every 2 weeks. If there's major things that change, we will add in a session. But otherwise, unless you hear from me otherwise, you'll see us. Our next one will be on May 13th. That's a Thursday, May 13th at 10 a.m. And then there's other great talks out there. There's a Doc Talk Live April 22nd from an amazing gastroenterologist here at NorthBay, Dr. Nazia Hassan. And the title is When It's More Than Just Heartburn. Absolutely join if you can. You will love her if you don't know her. And otherwise, be safe and have a wonderful weekend. Thank you.
Thank you, Dr. Kaufman.